This is good.
Okay. Did you start?
On you?
Okay. So I'm here today with Terry Roop, the administrator of Dickinson County Community Hospital. We're just going to ask her a couple questions. So I guess my first question I want to ask is, are you from this area?
I'm not from Clintwood, but I am from Wise County.
Are you? Okay.
Yes.
Have you always worked within the medical field in this area?
Pretty much for the biggest part of my life. I started out at Norton Community. I was a registration clerk there in radiology and registration, ER registration, while I was getting my ADN degree. So I worked night shift, and that was probably 15 or years or so ago. So, yes.
Oh yeah. I guess my next question is going to be, how has COVID affected this hospital? The regulations.
Well, as far as the regulations, those are set by ballot and not by Dickinson Community. So you guys got the screening when you came in, so that's one of those. And then, of course, you know, a lot of our visitation and that kind of thing. We only have one unit other than the ER that you can have visitation in, and that's our Gerald Psych unit, Green Oak. And it's a behavioral health unit for elderly people. So because of their age and the population of those patients, we have not allowed visitors since COVID has started. Simply because COVID is more prevalent in that age group, and we don't want to possibly bring that in. Thankfully, we had one COVID case in our unit, but it didn't affect anybody else. As far as our other visitation, you're allowed one in the ER, but as far as outpatient, no visitors were allowed in the beginning, but now you can have at least one to go in.
Has the ED visits increased since COVID started?
No, actually, our volume is probably down by about 200 patients. And what we're kind of linking that to is the fact that a lot of patients who did not have primary care doctors, they would use our ER to take care of tooth pain, for coughs, congestion, sore throat. Those patients are not coming into the ER as much as they were before. They're trying to hold out, or they're going to their primary care physician, which makes it a lot more safer for them. Not that we don't, you know, want them here, because that's what we're here for, but yeah, the volume has dropped.
Yeah, I didn't know, because I know some of the hospitals I've been around, they've actually had an increase because, you know, they have any symptom and they think they don't have it,
Right.
of course.
Not so much here.
Right. Do you all swab them here if they come in with symptoms? Or?
It is left up to the doctor's preference. If the doctor feels that they have the symptoms that meets that criteria, then they will swab. Or if we are transferring a patient, a lot of times the receiving facility will request that patient to be swabbed for COVID prior to admission. Depends on what the situation is, though.
Have you all started offering vaccinations here, or would they need to go somewhere else?
They would have to go somewhere else. Right now, it's just in the clinics and the pharmacies locally. I'm sorry, it's not in the clinics. It's just in the pharmacies. And Ballot Health is scheduling a few here and there at different places, but Dickinson Community is not one of those.
Would you make any improvements to this facility?
Well, right now we're pretty much at capacity. Our psych unit is a 10-bed facility, and then we have a med-surg bed down in our ER that we could put a patient in. We actually have 2 rooms. They would just take up the ER rooms that are currently down there, but we can't admit 2 patients here. I would love to do some improvements, but at this point in time, I don't think that there's much that we could do to expand or anything like that. We have an outpatient clinic for Gerald Psych as well down the hall there off of the elevator. And that's an outpatient program, which they're doing that now by telehealth or telepsych. So in order to be able to expand any, it would just be down this hallway, and there's only 3 or 4 rooms. And there will be all kinds of renovation, because with the psych, if I expanded on the psych unit, there are a lot of regulations with psych that says, you know, you have to be compliant in certain areas. For instance, you can't have these kind of tile ceilings that we have. It has to all be solid, which requires a lot of work in the end to remodel a facility to do that, because they're all like this. So I would like to, but it's not feasible at this point in time.
Do you all stay at max capacity?
For the most part, sometimes depends on staffing, depends on the acuity of the patients, depends on what's going on in the unit. There could be repairs going on in a room or something. But we try to stay at max capacity, usually 8 or 9. Our average daily census right now is 6, but that's only because we have not had a lot of patients in. Last February, or this past February, though, our average daily census was 8, which is usually where we stay. So, yes.
I guess one of my final questions is going to be, how do you think the socioeconomic status of the individuals in this area affect their overall health?
I think it affects it greatly. There's a lot of patients that can't afford health care, and that's where our ER comes into play. Although you still get a bill, it's the place that they can turn to, because you have to have money to see a physician or to be established with a physician. You know, they expect those co-pays up front and that kind of thing. So I think it definitely affects, you know, I guess people going to healthcare and seeking out treatment and that kind of thing. They tend not to because they don't have the money. And a lot of things here too is surrounded around transportation. Although we have a bus that runs regular to the hospital, it's still sometimes hard for people who are not really mobile to be able to get to that bus stop.
Oh, yeah.
So, you know, you can say you have a bus and that, you know, people can use it, but you got to be able to get to that bus, you know, and where the pickups are. And then people, you know, without jobs, a lot of times they won't have a vehicle because food or home is more important, you know, so therefore, you know, they may not have a way to come and get the health care that they need.
I guess in regards to the bus, does it run 24 hours?
No, I think 8 p.m. is the last time that it runs. It's a Dickinson County Transit, I think is what the name of it is. I'm not sure. But they do different counties. I think there's one in Wise County and that kind of thing, but still, you got to be able to get to that bus stop if you can.
Do you know if the EOC comes through here?
I don't think that they do, but I can't be positive whether they do or not. I'm not sure.
Yeah, we've been, you know, we're doing a windshield survey, and we've been through a lot of the communities here. And, you know, it's some of the roads, you know, they're bad, and I can see how transportation could be a major issue.
Right, exactly.
But I think that's all the questions I have. But thank you very much.
Well, you're welcome. Absolutely. That was quick and easy.
Okay.